purchasing staples like rice, beans, and oats. In bulk not only saves money, but ensures you always have a solid foundation for your meals. Point 3. Seasonal produce. Ah, the beauty of seasonal produce. Opt for fruits and veggies that are in season. They're not only fresher, but also more affordable. Pro tip: farmers markets are fantastic for scoring some great deals. Point 4. Frozen is your friend, don't shy away from the frozen aisle. Frozen fruits and vegetables are often just as nutritious as fresh ones and have a longer shelf life. Plus, they can be more budget-friendly. Point 5. Meal prep magic. Meal prep is a game changer. Spend a few hours each week preparing your meals in advance. Not only does it save you time, but it also keeps you from opting for those less healthy, on-the-go choices. Point 6. DIY snacks. Snacking doesn't have to be a guilty pleasure. Make your own snacks at home, like trail mix or granola bars. It's not only healthier, but also more cost-effective. Point 7. Store brands rock. Let's talk about loyalty. Store loyalty. Don't overlook store brands. They're often just as good as the fancy labels, but come with a friendlier price tag. Point 8. Coupon craze. Coupons, coupons, coupons. Embrace the coupon craze. Keep an eye out for discounts, both online and in-store. They can add up to significant savings over time. Point 9. Buy frozen proteins. Protein can be pricey, but fear not. Frozen proteins like chicken breasts or fish fillets are often more affordable than their fresh counterparts. Stock up when you spot a good deal. Point 10. Nourish on a dime. Nourishing your body doesn't have to cost a fortune. Opt for budget-friendly superfoods like lentils, quinoa, and sweet potatoes. They pack a nutritional punch without emptying your wallet. Outro, and that's a wrap for today's video on healthy eating without breaking the bank. If you found these tips helpful, don't forget to give us a thumbs up, hit that subscribe button, and ring that notification bell so you never miss out on our budget-friendly recipes and wellness tips. Until next time, stay healthy and budget savvy.
Pregnancy week 1 to 2. 1 and 2 weeks pregnant. Congratulations! During the first and second week of pregnancy, your body is preparing for possible conception. How is pregnancy calculated? Calculating the day your baby begins to develop and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates.
What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important thing you need to understand when trying to conceive. Ovulation occurs when a mature egg is released from the ovary, pushed down the fallopian tube, and available to be fertilized. The lining of the uterus has thickened to prepare for a fertilized egg. If conception does not occur, the uterine lining will be shed. The shedding of an unfertilized egg and the uterine wall occurs during menstruation. There are also several facts that you need to know concerning ovulation. An egg lives 12 to 24 hours after leaving the ovary. Normally, only one egg is released each time you ovulate. Ovulation can be affected by stress, illness, travel, and significant changes in weight, exercise, and sleeping patterns. Some women may experience light spotting during ovulation. This is not considered to be an actual period, but rather an ovulatory bleeding. What is happening with your baby? Nothing is happening yet, but be patient while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11, day 21 of their cycle. This is what many refer to as the fertile time or fertility window of a woman's cycle because sexual intercourse during this time increases the chance of pregnancy. For more information on tracking ovulation, please see Fertility Awareness, Understanding Ovulation, Ovulation Calendar. What should you plan at this time? There may need to be some lifestyle changes made at this time to increase your chances of conceiving and having a healthy baby down the road. Adequate exercise and a balanced diet are important factors to evaluate. It is recommended to begin taking prenatal vitamins and stop using substances such as caffeine, artificial sweeteners, alcohol, recreational drugs, nicotine. If you are taking prescription drugs, check with your healthcare provider to see if such medication is safe to take during pregnancy. For more information on nutrition during pregnancy, please see our information on preconception nutrition. Tips for making your pregnancy better. The most important thing you can do right now is to act in the way you would if you already knew you were pregnant. Since it can be weeks before you know if conception has occurred, this will protect both you and your future baby from any substances or activities that could cause problems.
3 weeks pregnant. Sperm met egg last week, and voila, you've made a baby. It's so early that when you're 3 weeks pregnant, you may have no idea that you're actually pregnant. Conception just happened a few days ago, and there probably hasn't been time for you to miss a period yet at week 3 of pregnancy. Can you tell you're pregnant at 3 weeks? While some people feel no difference at all at this early stage, others may start to notice 3 weeks pregnant symptoms. The experience at 3 weeks pregnant can really vary, so don't fret if you don't feel anything out of the ordinary. However, if you feel nauseous and your breasts are sore, that's normal too. Everything changes quickly in early pregnancy, so no matter how you feel, be prepared to feel different in a week. 3 weeks pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness, or nausea so bad it makes you puke. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought. Or you may even be 3 weeks pregnant with twins. That's because twin moms-to-be often have higher levels of pregnancy hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, the amount of pregnancy hormone HCG in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come into the office for a blood draw. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later.
Before you start eating for two, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with at least 400 micrograms of folic acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation, comes a rise in the pregnancy hormone HCG. At the end of this week, there may be enough HCG to detect with a sensitive early home pregnancy test. First, what is your baby's due date? Your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.2 millimeters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. There inside your fertilized egg are all the cells that will develop into your baby and what your baby needs to survive for the next 9 months. The inner cells begin to transform into your baby's organs and body parts. The outer cells start to form the placenta. You and your baby at 4 weeks pregnant. Your baby at 4 weeks. In weeks 4 to 5 of early pregnancy, the embryo grows and develops within the lining of your womb. The outer cells reach out to form links with your blood supply. The inner cells form into 2, and then later into 3 layers. Each of these layers will grow to be different parts of your baby's body. The inner layer becomes the breathing and digestive systems, including the lungs, stomach, gut, and bladder. The middle layer becomes the heart, blood vessels, muscles, and bones. The outer layer becomes the brain and nervous system, the eye lenses, tooth enamel, skin, and nails. In these early weeks of pregnancy, the embryo is attached to a tiny yolk sac that provides nourishment. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. You at 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy, such as breast tenderness. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubal pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only one baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration. placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavy or bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant. thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too. 9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
"10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1, balanced diet, emphasize the need for a well-balanced diet, include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2, folic acid and iron, discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals highlight the importance of iron for preventing anemia during pregnancy, include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3, omega-3 fatty acids, explain the benefits of omega-3 fatty acids for the baby's brain development, include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4, adequate hydration, stress the importance of staying hydrated during pregnancy, recommend water as the primary beverage, limit caffeine intake and avoid sugary drinks. Point 5, calcium for bone health, discuss the need for calcium in supporting the baby's bone development. Include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6. Small, frequent meals. Suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7. Foods to avoid. List foods that should be avoided during pregnancy: raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion. Recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers.
Step-by-step guide to in vitro fertilization, IVF. How IVF works. 1. Introduction. Welcome to our step-by-step guide to in vitro fertilization, or IVF, the groundbreaking process that's helped countless families realize their dreams of parenthood. 2. Step 1. Fertility medications. The journey begins with fertility medications, typically administered as shots. These medications stimulate your ovaries to produce multiple mature eggs. The goal: to harvest 10-15 eggs, a process that typically takes about 2 weeks until your eggs are ready for retrieval. 3. Step 2. Egg retrieval. Next up is the egg retrieval process, a brief procedure lasting 15 to 30 minutes. During retrieval, a doctor utilizes ultrasound guidance to insert a thin, hollow tube through your vagina and into the ovary containing the eggs. A suction device connected to a needle gently retrieves the eggs from each follicle. 4. Step 3. Fertilization. Now, it's time for fertilization, a critical stage in the IVF process. In traditional IVF, eggs and sperm are left in a laboratory dish to fertilize naturally. Alternatively, in intracytoplasmic sperm injection, ICSI, a single sperm is directly injected into the egg for fertilization. This method bypasses natural barriers, increasing the likelihood of successful fertilization. 5. Step 4. Embryo development. Once fertilization occurs, the embryo begins to divide its cells, eventually reaching the blastocyst stage, 5-6 days post-fertilization. At this stage, multiple embryos are carefully selected for transfer back into your uterus. 6. Step 5. Embryo transfer. The final step, embryo transfer. Multiple embryos are transferred back into your uterus with the hope that at least one will successfully implant and begin to develop. 7. Conclusion. And there you have it, a comprehensive overview of the IVF process, from fertility medications to embryo transfer. If you're considering IVF or simply curious about the procedure, don't hesitate to reach out to a qualified fertility specialist. Thanks for joining us, and we wish you all the best on your journey to parenthood.
Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8.
communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content. Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegel muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing.
Understanding common causes of poor egg quality. Intro. Hello everyone. Welcome back to our channel. Today we'll be diving into a crucial topic for those navigating fertility and reproductive health: the common causes of poor egg quality. If you're new here, don't forget to subscribe and hit the notification bell so you never miss out on valuable information. Let's jump right in. 1. Age. As we age, the quality of our eggs naturally declines. Advanced maternal age is a significant factor in poor egg quality. 2. Hormonal imbalances. Imbalances in hormones, such as FSH and LH, can impact egg quality. Maintaining hormonal balance is crucial for optimal fertility. 3. Smoking to accelerate the depletion of ovarian reserve and negatively affect egg quality. Quitting smoking can positively impact fertility. 4. Poor diet. A nutrient-rich diet is essential for reproductive health. Lack of key vitamins and minerals can compromise egg quality. Focus on a well-balanced diet. 5. Obesity. Being overweight can disrupt hormonal balance and affect egg quality. Maintaining a healthy weight is vital for fertility. 6. Underweight. Conversely, being underweight can also impact fertility. Adequate nutrition is essential for optimal egg development. 7. Environmental toxins. Exposure to environmental toxins, such as pollutants and chemicals, can negatively affect egg quality. Minimize exposure whenever possible. 8. Stress. Chronic stress can disrupt hormonal balance and impact reproductive health. Incorporating stress management techniques is crucial for fertility. 9. Alcohol consumption. Excessive alcohol intake can be detrimental to egg quality. Moderation is key when it comes to alcohol consumption during fertility journeys. 10. Lack of exercise. Regular exercise promotes overall health, including reproductive health. Sedentary lifestyles may contribute to poor egg quality. 11. Ovulation disorders. Irregular ovulation patterns or disorders can lead to poor egg quality. Seeking medical advice for irregular cycles is important. 12. Genetic factors. Some individuals may have genetic predispositions that affect egg quality. Genetic counseling can provide valuable insights. 13. Polycystic ovary syndrome, PCOS. PCOS can impact hormonal balance and egg development. Managing PCOS through lifestyle changes and medical interventions is crucial. 14. Endometriosis. Endometriosis can affect egg quality by causing inflammation. Seeking treatment for endometriosis is essential for fertility. Thyroid disorders. Thyroid imbalances can impact reproductive health. Regular thyroid monitoring and management are important for optimal fertility. Diabetes. Uncontrolled diabetes can affect egg quality. Managing blood sugar levels is crucial for individuals with diabetes trying to conceive. Autoimmune disorders. Some autoimmune disorders can affect fertility. Consultation with a specialist is recommended for those with autoimmune conditions. Poor egg reserve. Low ovarian reserve can contribute to poor egg quality. Regular fertility assessments can help understand and address this issue. Infections. Untreated infections can negatively impact reproductive organs and egg quality. Prompt medical attention is important. Medication side effects. Some medications may have side effects that affect fertility. Consult your healthcare provider if you have concerns about medications and fertility. Outro. That wraps up today's video on the common causes of poor egg quality. If you found this information helpful, don't forget to give it a thumbs up and share it with others who might benefit. Remember, every fertility journey is unique, and seeking professional advice is crucial. Until next time, stay informed and take care of your reproductive health. Thanks for watching.
Title: Relieve Back Pain During Pregnancy, 20 Practical Tips for Moms-to-Be. 1. Introduction. Greet your viewers and mention the common issue of back pain during pregnancy. Highlight the importance of addressing and relieving back pain for a more comfortable pregnancy. 2. Consult your healthcare provider. Emphasize the importance of consulting with a healthcare professional before trying any remedies. 3. Maintain good posture. Explain how maintaining proper posture can alleviate strain on the back. 4. Gentle prenatal exercises. Suggest safe and gentle exercises to strengthen the core and back muscles. 5. Pelvic tilt exercises. Demonstrate pelvic tilt exercises for strengthening and flexibility. 6. Prenatal yoga. Discuss the benefits of prenatal yoga in relieving back pain. 7. Warm up before exercise. Emphasize the importance of warming up before engaging in any physical activity. 8. Supportive footwear. Recommend comfortable and supportive footwear to reduce stress on the spine. 9. Use pregnancy pillows. Explain how using pregnancy pillows can provide extra support during sleep. 10. Regular breaks. Encourage taking short breaks to avoid prolonged sitting or standing. 11. Hot-cold therapy. Discuss the use of hot or cold packs for temporary relief. 12. Massage and acupressory. Highlight the benefits of massage or acupressure for relaxation and pain relief. 13. Hydrate and maintain a healthy diet. Emphasize the importance of staying hydrated and consuming a balanced diet for overall health. 14. Avoid high heels. Advise against wearing high heels as they can contribute to back discomfort. 15. Incorporate lumbar support. Suggest using a lumbar support pillow or cushion when sitting for extended periods. 16. Stay active. Encourage regular, low-impact activities to keep the body moving. 17. Swimming. Mention the benefits of swimming for buoyancy and reduce strain on the back. 18. Breathing exercises. Introduce deep breathing exercises to promote relaxation and reduce tension. 19. Consider prenatal massage therapy. Discuss the potential benefits of professional prenatal massage for back pain relief. 20. Conclusion. Summarize key points and remind viewers to consult with their healthcare provider before trying any new methods. Remember to speak clearly, use engaging visuals, and make it easy for viewers to follow along with the practical tips you're providing.
Hello everyone, welcome back to our channel. Today, we are going to discuss the early signs of labor that expectant mothers should be aware of. If you're new here, consider subscribing and hit that notification bell so you won't miss any updates. Let us get started. The first sign is lightening. This occurs when the baby drops lower into the pelvis, relieving pressure on the diaphragm. Moms-to-be might feel increased pelvic pressure and notice their baby bump is lower. Braxton Hicks contractions. Next up, Braxton Hicks contractions. These are irregular, painless contractions that help prepare the uterus for labor. They may feel like a tightening or hardening of the belly. Increased discharge. As labor approaches, you might experience increased vaginal discharge. This is known as the mucus plug, and it protects the cervix during pregnancy. Losing it is a sign that labor could be near. Nesting instinct, feeling an uncontrollable urge to clean and organize that's the nesting instinct kicking in. Many expectant mothers experience this surge of energy right before labor. Diarrhea or nausea, hormonal changes can lead to gastrointestinal changes too. Diarrhea or nausea might occur as your body prepares for labor. Back pain, persistent lower back pain can be a sign of labor, as the baby's head presses down on the pelvis and sacrum. Rupture of membranes, when the amniotic sac ruptures, commonly known as the water breaking, it's a clear indication that labor is imminent. This might be a gush of fluid or a slow trickle. Contractions, last but not least, true labor contractions. These are regular, progressively intensifying contractions that help the cervix dilate and efface. Conclusion, remember, every pregnancy is different, and not all women will experience these signs in the same way or order. If you notice any of these signs or have concerns, always reach out to your healthcare provider. Stay tuned for more pregnancy-related content and take care. See you in the next video. Outro. Thank you for watching. If you found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe and hit the notification bell to be notified of our future videos. Stay safe and take care. Bye.
Understanding Miscarriages, a comprehensive guide. 1. Introduction. Welcome to today's video, where we'll be delving into the sensitive topic of miscarriages. Miscarriage, the natural death of a fetus before viability, usually within the first 20 weeks of pregnancy, is a subject that affects many expecting parents. 2. Definition and prevalence. Medically termed as spontaneous abortion, miscarriage is one of the most common pregnancy-related issues. According to the American College of Obstetricians and Gynecologists, ACOG, approximately 15% to 20% of clinically recognized pregnancies end in miscarriage. 3. Impact and trauma. While miscarriage is relatively common, it can be an incredibly traumatic and devastating experience for individuals and couples. Many women may even experience a miscarriage before they realize they are pregnant or before it's confirmed by a healthcare provider. 4. Risk factors and predicted risks. The risk of miscarriage varies depending on factors such as age and previous miscarriages. For women under 35, the risk is around 10%, while for those over 40, it rises to about 45%. 5. Types of miscarriages. Miscarriages can manifest in different types, including threatened, incomplete, complete, missed, and recurrent miscarriages. Each type presents unique symptoms and challenges. 6. Causes of miscarriage. While many women blame themselves, most miscarriages occur due to reasons beyond their control. Common causes include chromosomal abnormalities, weakened cervix, uterine abnormalities, and underlying health conditions. 7. Risk factors and symptoms. Factors such as obesity, advanced maternal age, previous miscarriages, and substance abuse can increase the risk of miscarriage. Symptoms may include vaginal bleeding, abdominal cramps, pelvic pain, and the disappearance of pregnancy symptoms. 8. Diagnosis and prevention. Miscarriages are diagnosed through tests such as transvaginal ultrasound, blood tests, and pelvic exams. While most miscarriages cannot be prevented, steps can be taken to promote a healthy pregnancy, including maintaining a healthy lifestyle, attending prenatal appointments, and discussing concerns with a healthcare provider. 9. Conclusion and call to action. Thank you for joining us as we explored the sensitive topic of miscarriages. If you found this video informative, please remember to like, share, and subscribe to our channel for more educational content. Together, let's raise awareness and support individuals and families navigating the complexities of pregnancy loss. 10. Outro. Until next time, take care and remember, you're not alone in your journey.
Teenage pregnancy is when a female under the age of 20 becomes pregnant. It is a global issue that affects millions of teenagers every year. Teenage pregnancy can have serious physical, emotional, and social consequences for both the mother and the baby. It is more common in low-income communities, where access to contraception and education may be limited. Lack of knowledge about sexual health, contraception, and healthy relationships can contribute to teenage pregnancy. Teenage mothers are more likely to drop out of school, which can limit their future opportunities and earning potential. Teenage fathers may also face financial and social challenges as a result of the pregnancy. The rate of teenage pregnancy has been declining in many countries, but it remains a significant problem in some regions. Prevention programs that provide education, counseling, and access to contraception have been effective in reducing the rate of teenage pregnancy. Support for teenage parents, including medical care, childcare, and education, can help mitigate the negative effects of teenage pregnancy.
healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems.
Journey through the stages of pregnancy. Objectives. Define the 3 main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify of each pregnancy stage, including the weeks and months. Explain the physical and during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters. Each approximately throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester pregnancy weeks 14 to 17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice skin to protect it in the amniotic fluid. Pregnancy weeks 23 to 27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester pregnancy weeks 28 to 31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32 to 35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organs and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36 to 40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next, summarize key points. Reiterate the importance of accuracy and offer encouragement to viewers.
Top 20 Tips for Natural Conception, your ultimate guide. 1. Track your menstrual cycle to identify your fertile days. 2. Healthy lifestyle. Maintain a balanced diet, exercise regularly, and avoid excessive stress. 3. Maintain a healthy weight. Both underweight and overweight can affect fertility, so strive for a healthy BMI. 4. Regular exercise. Engage in moderate exercise to enhance overall health and reproductive function. 5. Limit caffeine and alcohol. Excessive caffeine and alcohol intake can impact fertility, so consume them in moderation. 6. Quit smoking. Smoking can reduce fertility, so kick the habit for a healthier reproductive system. 7. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 8. Stay hydrated. Drink plenty of water to keep your body well hydrated. 9. Nutrient-rich diet. Include foods rich in vitamins and minerals essential for reproductive health. Acid. Intake. Take a prenatal vitamin with folic acid to reduce the risk of neural tube defects. 11. Reduce toxin exposure. Limit exposure to environmental toxins that can impact fertility. 12. Know your ovulation signs. Recognize ovulation signs such as changes in cervical mucus and basal body temperature. 13. Optimal sexual positions. Certain positions may increase the chances of sperm reaching the egg. 14. Regular intimacy. Aim for regular intercourse, especially during your fertile window. 15. Reduce stress. Practice stress-reducing techniques like meditation or yoga to promote fertility. 16. Avoid lubricant